to join us today. We are recording this presentation, so that way you have it for future reference or can share with your colleagues who aren't available today. So we are excited to hold another session to address new questions that you all have on your needs assessment processes. Let me just go to the next slide. Presenting today, we will have Jen Lesko, our TA lead, as well as Chris Bosco, who's a senior TA advisor, and I am Sammy Couture, the TA manager of the project. So just first, before we get into the topic area, I just want to say I know we sent you a few emails over the last week or so, and just wanted to highlight some of those for you, just so we all are on the same page. You should have received the strategic plan guidance that came out last Monday, and we'll be having a community of conversations similar to these on the strategic plan on Monday the 17th of June, so you should have received that. We also sent a notice that this Thursday at 2 p.m. Eastern, we're partnering with the State Capacity Building Center for a webinar focusing on national consumer education resources. So it'll provide an overview of some resources to help states and territories with consumer education information to families. So if you didn't see those in your inbox for some reason, let us know, you let your TA specialist know, and we'll make sure you get on those. Just highlighting that these community of conversations are voluntary, so we do really appreciate your time and interest in the discussion today. We'll address questions that have come in. We're going to hear from our partners in Kentucky and Maryland about their needs assessment work. And then we'll take additional questions from you all. So you can put your questions in the chat box throughout the discussion today. You can also raise your hand at the top, and we can call on you. All guests are muted, so that way we keep the background noise low, but if we call on you, you can always hit *6, which will unmute yourself, and then we can hear you. So we appreciate, again, your time, and now, oh, one more thing, we have our web page with resources available. So you may have seen that in an email from us, but here's the link as well. You can find the PDG B-5 resource page that has the needs assessment guidance. It has some tools that we've sent out, so it's all in one place here for you, and here's the link. And now I will send it over to Chris to get us started.
Hi everyone, good afternoon to most of you, and good morning if there's anyone on from Alaska and Hawaii. So I'm going to kind of go over what the plan is for today, and you're welcome to start putting in questions whenever you have them. I will start with the need assessment guidance conversation approach. So we're gonna start with some questions from grantees. These are some that we've already heard. Then we're going to do some additional participant questions and discussion as they occur to you. There are a few grantees who have been kind of prompted to ask whether they'd be willing to share their experience to date, and we will hear from them somewhere in this process. And we'll talk a little about the needs assessment submission process. Hopefully every one of you has seen the Q&A and the additional information that Richard sent out that explains a few more details about the needs assessment process. We'll go over that today. Then we'll see if there's any whatever the conversation takeaways are and any suggestions for improving these conversations in the future. And then we'll talk about upcoming activities and closing. So I will start with a few topics, and like I said, as questions occur to you, please feel free to put them in the chat box, or you can also at some point unmute and we can ask questions. So a few questions that have occurred and that we didn't necessarily cover in our last one after soliciting some. One is about the target audience for the needs assessment. I think the main answer is it depends on what works for you in your state. We would expect that the audience definitely includes agencies, organizations, and parent leaders in early childhood, as well as policymakers. Some states may want to do a broader plan that any parent or interested party might pick up. Others may want to focus on a smaller audience. I would suggest that even if the plan itself focuses on policymakers and early childhood specialists, it may be useful to have a summary to share with a broader audience that maybe is a little less detailed. So just something to think about as you do that. Then in terms of demographics to include, we had a few questions on what demographics you should include in your needs assessment. And whether you should include them all was one of the questions. And in order to provide context, a strong needs assessment should start with the demographics of young children as a whole in your state. And you certainly want to show indicators of vulnerability, such as poverty and low-income families, maybe things like low birth weight. Partly depends on your area of focus, but things that kind of show who the vulnerable children and families are in your state. You will also likely want to show differences between subgroups, for example, race and ethnicity, possibly also rural and urban versus urban, if that's something you can kind of get in your state, and as a useful kind of way of looking at different vulnerable populations and differences between populations. I think it's always useful to see, what do the children look like in your state as we start talking about the needs assessment. It helps provide the context that really is important to understanding the rest of the needs assessment and then eventually to your strategic plan and why you're doing what you're doing. What programs to include in terms of number of children being served? So there is that one section of the needs assessment where you're asked to report on the number of children being served to the extent that you have data on that available. So for that, you definitely want to include all your early care and education programs. For others and what other data you provide, it largely depends on how you want to use the needs assessment. At a minimum, I think it would be useful to provide information on the number and percent of children in Part C and Part B in your state. But as I said, you're not necessarily required to provide information on the number of children being served in non-early care and education programs. But if they're useful, if they help understand where you're going and what you're trying to do, and understand the condition of children and families in the state, then it may be useful to include information. Or to say that you don't have the information, that you'd really like to know something, but you don't have it, and maybe that's something you explore as an activity you want to pursue in your strategic plan. Okay. Next is defining vulnerable populations. Last time we had some questions about whether you have to stick with the definition of vulnerable populations that you used in your application. Just to reiterate, the answer to that is no. If your needs assessment leads you to add or modify the vulnerable populations, that's great. I mean, the whole purpose of doing a needs assessment is for you to take a much closer look at the condition of children and families in your state and the conditions of programs. So if it leads you to modify it, that's fine. You need to explain why they are selected as vulnerable in your needs assessment, but you don't have to necessarily say, well, this is what we said in our application, this is what we changed, this is why we changed it. If that's somehow helpful and helps to explain how your thinking evolved, that's fine, but it's not necessary. Really, your needs assessment is going to be reviewed as your needs assessment alone. It's not really an issue of kind of comparing it to what you said you do in your application in that relation. Measurable indicators is another set of questions we've had some questions on, or another component of the needs assessment we've had some questions on. So one of the things was whether they could be selected and defined during the strategic planning process rather than the needs assessment process. With the idea being that you have, as you pick what you're going to focus on, that's where your measurable indicators are going to be. And that is something you can definitely do. You should know what you are doing and how you plan to go about it in the needs assessment. You may want to use your needs assessment to research possible indicators, and if you do, it would be good to report it. If you decide to wait until the strategic planning process to define your indicators, you should address the needs assessment questions from the guidance on the needs assessment in your strategic plan. So you don't necessarily have to do it first, but you should really look at those questions if you decide to wait. And you should say in your needs assessment that we're waiting on indicators until our strategic plan and explain all that so that it can be seen that you actually kind of looked at that. Okay. Next was a facilities issue, and we've had some questions about that. This is a required component of the needs assessment, so even if it doesn't come up as a specific issue in regard to community or agency input, if you're not hearing people say, well, you know, facilities is a major concern of ours, it is still important to indicate what is known about child care facilities in your state. And oftentimes this may be something you can find in other previous needs assessments if that's it's certainly worth looking at. If not much is known, that is something to report, and finding out more might be something you want to consider in your strategic plan. But I would suspect that in lots of cases there may be some local studies on facilities, there may be some statewide studies. It's certainly, no matter how you, how much the issue is brought up or not, I think you definitely want to talk. It's one of those topics you definitely have to cover. And the same is true for transition, which I think is a very similar in terms of facilities. Regardless of what you're hearing in terms of input on the transition issue, it is a required topic for the needs assessment. And research shows it can present challenges. You definitely want to take a look and see if it has been covered in other needs assessment in your state or research, either at the state level or community level. Which reminds me, no matter what, even if whatever your needs assessment process is, you definitely want to review previous needs assessments, and we've shared some of those. If you have any questions about, well, what needs assessments might you look at, your TA specialist can certainly provide you with a list of those. I know Bill put out a list of those, and we can certainly share that. Just so you know. And the last kind of topic that's already been covered and questions that we've had is the issue of system integration. One of the goals of PDG is to encourage stronger integration of the early childhood system. That means engaging all the key stakeholders in the early childhood, early care and education system and beyond. One of the reasons why your FPOs are asking you to invite different stakeholders to quarterly calls is to get a sense of how you're going about this. So system integration is a big part of PDG, so that's one of the rationales behind that. Something to consider, what's going on, what's working, what's not working, what can you do in your strategic plan to strengthen system integration. So I'm going to check and see. I don't know if there's any questions that have come up. Tim or Sammy, is there anything in the chat box that I missed?
No, not yet.
Okay. So I
Kristen?
think, go ahead.
I thought I would add a few comments related to the issue of facilities. And this has come up as a result of looking at a few of the drafts of needs assessments that have come across our desk so far. Two items to think about concerning facilities. One, you mentioned, Chris, that there may already be some existing data in states that explore the concept or issue of facilities. And an example would be, I know that in a few states, in relation to their quality rating and improvement system, there was or has been some exploration of what it would take when looking at an average center to raise that quality of that center up their level of quality, level from 2 to a 3, 3 to 4, 4 to 5, or whatever rating system that states are using. And several states came up with some average numbers of what it would cost them to move those centers up. So, an extrapolation of that calculation across a number of centers to make sure that the children that you're proposing to be a part of the mixed delivery system are in some higher level of quality of early care and education, and then what it would cost to be able to do that would be something to consider. Another calculation would be if a state is looking at numbers of children, and it's important to consider if there's an unmet need of children, does the existing early care and education system, is it at capacity to absorb the number of unmet needs, so the number of children who may not currently be in service? And if it is already at capacity, then another calculation would be what might it take in terms of additional facility spaces, seats in centers or centers with square footage to meet some level of absorption of those numbers of kids who may need to be in a place that currently are not. So those are two other aspects related to facilities that states may want to think about.
And this is Chris, and I would add a third, which is the question of making child care centers more inclusive. So in terms of, what facility changes, do you have any programs out there that can help a child care center that might need to make facility changes in order to accommodate children with special health care needs? Or are there other things you could do to facilities? And if not, I mean, is that something you could possibly, you want to look at in terms of whether there's a need out there, and then later on whether there's something you could do maybe in terms of a pilot program that could support efforts to build greater inclusivity.
Okay, great. This is a good opportunity to do a bit of a switch. Last call, we had a few states that had also agreed to share some of their experiences around needs assessment, and we ran out of time and didn't have an opportunity to have those willing speakers share their experience. And so I thought first, before we go to some other questions, I'd like to turn it over to John Roden from Kentucky. John, I believe you're on the line, perhaps
yes,
we
sir,
need to get.
On.
You're on?
Yes, sir.
Excellent. Great. So, John, maybe it would be helpful if you could introduce yourself and where you're from, and if you want to talk with us a bit around your needs assessment process in Kentucky.
Absolutely, and thank you for having us on today and convening this group. My name is John Roden. I'm the project manager for Kentucky's PDG, and as we're going through, I'll try to keep it high level and then entertaining questions after. The Kentucky's Preschool Development Grant is operationalized through the Governor's Office of Early Childhood with oversight from the committees established under the Early Childhood Advisory Council. The data subcommittee of the ECAC was primed to take on oversight of the needs assessment, and the ECAC contains representation from major state agencies, from Cabinet for Health and Family Services, the Department of Education, DCBS, Head Start Collaboration Director, Education and Workforce. And part of the success that we've had at this point has been through the networking, both formal and informal, with our state agencies, but not just at the program director level, but as well as the cabinet secretary and their ongoing participation and support. The data subcommittee of the ECAC first reached consensus on definitions. The definitions have guided much of our work in compiling and presenting information to our stakeholders, as well as to the executive committee and the ECAC in large. The primary definition is vulnerability, and Kentucky is drawing on existing agency definitions of vulnerability, which focus on poverty and the income poverty ratio that is used by different agencies to qualify for services. And from there, we examined agency priorities. and these are subtables for taking a deeper dive into vulnerability. The Kentucky Center for Statistics, it's KY Stats, they have been a phenomenal partner. They publish annual county level data for many of the topics of interest within the state, so we've been able to work alongside KY Stats, and their staff have been part of our data subcommittee as well as each of our committee memberships. So as the members are going through examining the pieces from the needs assessment, they're able to identify the data gap analysis, make those requests, and then move that forward.
Hey, John?
Yes, sir.
Can I interrupt you just for a second? Some of the participants have asked if you could speak a little bit louder.
Oh, I'm very sorry. I think I may have turned down my off of my speaker here. Is that better?
That's much better. Thank you so much. Sorry to interrupt.
Fantastic. Well, I was saying, in addition to working with KY Stats, we also were able to progress forward from the Race to the Top grant and the validity and sustainability study with our implementation support team through Compass Evaluation and Research, which positioned Kentucky's PDG ahead as we were able to identify and write and procure those services. And Dr. Sarah Hennemeyer and her team have been phenomenal in identifying and having that outside look. So as we are developing the relationships internally within the state, we also have the ability for the external overlay and to identify those content experts that can help push in certain areas. And most recently, as we're going through the last phases of our needs assessment, preparing for submission, it's able to take back with the GIS for the mapping of the data sets, identifying poverty pockets, areas of child care deserts, and then making the projections of where we need to move as far as on the allocations of resources and our dollars moving from not just this year within the budget session, but also for the next 5 to 10 years. And I believe that Dr. Hennemeyer was joining as well.
Great. If she's on, you just want to press *6, and then we can all hear you.
Can you hear me now?
Yeah.
Perfect. Thanks.
Okay. Yes, I'm online.
And Sarah, I didn't know if there's one pieces as part of, for our team to add in or to clarify as well.
We started planning for the needs assessment back in the fall when we were pulling the proposal together. So we were able to initiate focus groups around the state as well as some surveys to inform some specific sections of the needs assessment. We know that we wanted to do a lot of work on transitions. That was part of our proposal package. And so getting a transition survey out there and being able to kind of hit the ground running come January, we kind of developed a plan and an approach to the needs assessment back in the fall. And I think that was also something that really helped us get started very quickly and reach out to folks quickly and get some events scheduled.
This is Jim. Seems like I'll ask this question. Are there any lessons learned from the process that you think might be helpful to share with states that you might do differently, or you do a little bit better, stronger, or you would say I'd stay away from that, sort of a pitfall?
And this is Sarah. I don't know if it's a lesson learned so much as an ongoing learning on the iterative nature of the work. We learn a little, we learn a lot, we come back to the team, and Kentucky has invested in a very engaged process with its ECAC and with its partner agencies. So constantly appreciating the iterative nature of the work of bringing data back to the table and then being directed to drill down a little farther. I think and I'll let John respond to this, I think we're getting to the point where we are getting ready to submit, but that iterative process and kind of ongoing conversation continues, and I expect to keep going even after we submit this product. John, I'll let you agree or expand on that.
I would echo the same that Sarah was sharing, and it's one of the processes that have been very pleased with the team and just the stakeholders allowing the data to guide, and as we have new information and asking those questions, that we're able to hone in and sharpen our understanding of the landscape. From the meeting we just finished up earlier today, then the same thing of what is that next dive, what's the next layer of information to develop policy as we're looking into the future, and we are getting closer to that time to where it's having a very solid needs assessment and our solid strategic plan to guide the work, knowing that as holes of data may be filled in the future, that we will come back and make those modifications.
Great. Thank you so much for sharing that. Are there any questions that those attendees would like to ask while we have John and Sarah on the line?
I think John, this is Sarah again, John had mentioned this, but to one of the questions in the chat box, Kentucky had just completed its validation study, and in that study had the chance to do some surveys with early care and education professionals across the state, and we were able to rely on that raw data to inform our understanding of professional development and feedback on technical assistance and drivers for quality.
Great. Thank you so much. I know that it's interesting to explore some of the areas and questions that states have decided to focus in their needs assessment process. While workforce was not necessarily a targeted domain as a part of the needs assessment, I know that there have been a number of states that have included practitioners, professionals, and the issue of professional development in the workforce as a part of their needs assessment, exploration, and data in their state. So we did have a question from Deborah Anderson about states are any states conducting a provider survey to assess gaps in professional development? So it sounds like Kentucky has done that. If there are other states as well, as soon as Sarah and John are done, that would be willing to share some of that survey process with us today on the phone, I'm almost positive there's a couple other states that would be interested in hearing what you've done. Well, thanks so much, John and Sarah. I really, we on behalf of PDG B-5, EA, thank you very much for being willing to come on the phone today. Share your work.
Absolutely.
Thanks so much.
And this is Chris, and so I think one of the things we'd like to do is open it up to that. Has anyone done a survey that's designed to assess gaps in professional development or assess issues related to professional development, even if it's just not targeting on that? If you do, you can press *6 and let us know about it. Or Leslie says that Louisiana has a lead teacher survey that assesses professional development. Oh, multiple attendees are typing.
Leslie,
and there's a real... Go ahead.
Sorry. I was going to say, Leslie, would you be willing to talk about how you arrived at the questions you created or that were created for the teacher survey? I know that and or Tracy, I saw Tracy from Alabama indicated that they do a survey once a year. And a question we have received in a few cases from states is, can we share examples of the types of surveys that states are using? I know that they want to specifically look at questions, but out of my own curiosity, I'm always interested in how states arrive at the questions that they decide to use. And I'm sorry to put you on the spot, but if there's anybody else besides Leslie that also would be willing to share that information, I think some of your colleagues would be interested. Oh, Leslie says she's dialing in. So, and Tracy said Alabama will share the survey. So thanks very much, Tracy. We appreciate that, and we'll get up with you and how to get a hold of that survey so we can send it out to your colleagues. While we're waiting for Leslie to sign in, I know we've had a couple other questions came in online prior to our call today. And one of those questions that was asked is, what sort of guidance is out there concerning the number of needs assessments that they should be looking at from providers across the state? I mean, I'll start first, Chris, is I don't think that there's a set number of needs assessments. I would say if you are aware that there's other assessment reports that have been completed, I would try and gather as many as you can. It's better off doing an aggregate or qualitative analysis of a number of reports and reaching some conclusions that you can put into your needs assessment, rather than overlook something that may sort of skew the data or send you in a different direction. So I know at least 2 states that I have worked with, they have been feeling, in essence, somewhat overwhelmed by the number of pieces of data that they brought in to their needs assessment process, and have had to strategize around the capacity of their own system, within themselves as a team to sort of weed through the number of reports, data that they have, so that they can target the most salient pieces of information to bring together for the needs assessment. Chris, did you have any other guidance to offer there?
No, I think that's right. I mean, it's good to try and get as much as you can. I mean, I think that there's a variety out there. There's the McVie needs assessment. There's START work on this. There's your state maternal and child health needs assessment that takes you kind of into the broader early childhood system. So just kind of getting a variety and kind of looking at them, looking at their conclusions and what they've drawn and the data. I mean, it may be that in some cases especially if they're really recent, they may have done some of the work that you need to do, and that always makes things a little easier, even if it takes a little time to process all those questions. And I know Leslie is now on, so if you haven't hit *6, if you could do that, then we could hear from you about your experience with the lead teacher survey.
I'm on. Can you hear me?
Yep, coming in clear.
So our lead teacher survey is sent out to all teachers, all lead teachers of early childhood settings that are funded by public funds. And the things that we cover, we have like specific buckets that are highlighted, and professional development throughout those buckets. So specifically the tools that we focus on, class, gold, our assessment piece, and curriculum. And then we break it down even further, and if you're child care, we ask about your experience and your professional development with your child care resource and referral agencies, and also the PD that they take with our lead agencies. And we use the results from the survey along with our family survey, and they are calculated, and we receive a score for the community network performance profile that is put online. So each site has their own performance profile with their class scores, and then each community network, which in most cases is the school system, also receives a score, and part of that score is based on results from the lead teacher survey. So it helps us get more participation because the districts or our lead agencies will want to make sure that their teachers respond to the survey.
Leslie, what is the survey sent out online, or is it paper, and how has been your response rate?
We send it out. We use the email addresses that teachers enter for their classroom on TS Gold, and we send out an email blast to all of those lead teachers, and then with a link to the survey. So it's an online survey. And then we also send it to our lead agencies and have them send reminders to make sure that their teachers are taking it. And then midway through, I looked at the survey to see which districts or which lead agencies had fewer than a certain number of responses, and contacted those lead agencies directly to kind of incentivize them to get more of their teachers to respond. And we also sent them to our child care providers. We have a listserv with that.
And has your response rate been pretty good?
I think I have about 3,000. It's a little bit of a dip from last year, and I think some of the email addresses we're getting, some of the responses we're getting kicked back. So either the email was not accurate, or a teacher might have switched roles, but the site was still using that email address to get into Gold. So we might look and see about finding another way to do it next year also, or to clean up the email addresses that we have in Gold.
Great. Thank you so much for coming online. I appreciate it. Sorry to put you on the spot, but I do appreciate this information. Anybody else have any questions for Leslie while we have her online? I'm not seeing anything. Thanks so much, Leslie, for coming on. I appreciate it. So before we move on to some other questions, and I want to make sure that we get to our other state, Chris, Rachel Dema from Maryland is also on the line today, and Rachel is director of the PDG program for Maryland. And just sort of give you a little preface here, Rachel, Maryland has done a very unique, I think, activity and established a comprehensive, I think, approach to focus groups reaching out to the local community. So, Rachel, if hopefully you're on, can you talk to us about what approach you're taking in your state?
Absolutely. Can you hear me?
Yes. Thank you.
Great.
Yep.
So happy to be on. Thanks for making time for Maryland. And I unfortunately don't have access to the Adobe website that you all are using right now, so I won't be able to see any questions as they come in. So please let me know if I'm missing things or folks would like further information as I'm talking through Maryland's process. I should also mention, I believe Stephen Hicks, our Assistant Superintendent for Early Childhood Education, is also on the line. So Stephen, please feel free to jump in as I move through a brief overview of Maryland's needs assessment process. So Maryland's comprehensive statewide needs assessment has 4 primary components, and then I'll talk a little bit at the end about some other tie-ins. through other facets of our PDG birth through 5 work. And I should also mention that at this point in the year, we're actually just coming to the close of our most active data collection period for the needs assessment. So this is a great timely conversation for us to engage in and offers us an additional chance to reflect on our own process. So we engaged with a number of partners as we approached this work. So the Mid-Atlantic Equity Consortium and the Policy Equity Group supported us in the implementation of several of the components that I'll talk about, as well as Ready at 5, which is a Maryland-based advocacy organization. So our 4 primary components of the process were the document review, or I should say R, since everything is ongoing currently. We haven't submitted anything. A document review, a series of town hall meetings, a series of focus groups, and a survey. So I'll just walk through each of those and just provide some broad strokes as to what we've been doing in Maryland. So the document review, as has been alluded to throughout the conversation, we really tried to take a broad approach and look across all the various kinds of needs assessments that are conducted through other programs within the state, including, I think I heard McVie mention, so home visiting, of course, Head Start, early intervention programs such as our Judy Center program. And in addition to the needs assessment, I should say we also, look at current data that we are able to, parse and analyze on a regional and jurisdiction and school and classroom level to help inform where we know gaps are occurring in the state. So of course we have our kindergarten readiness assessment and early learning assessment data, as well as another sort of just element that we're able to consult. And also the previous strategic plans, I think Kentucky referred to sort of the continuation of their race to the top work. Certainly Maryland has done a great deal of strategic planning and statewide planning in the past. So we want to also make sure that we're capturing those kinds of inputs into the strategic or the needs assessment process, which will ultimately inform the next iteration of our strategic plan under this work. So I believe we limited the document review to about a 5-year kind of radius, if you will, and I think that was fairly informal, but we wanted to make sure that we were capturing up-to-date information. So that document review will be folded into, or the findings of that document review and reflections will be folded into our overall needs assessment report. So our town hall process has been going on for the past several months, and I'll talk a little bit about that since that was really a core component of the process. So we conducted 18 town halls across Maryland's 24 jurisdictions. Some of these were grouped together based on geographic proximity, but we also wanted to make sure that we were, really able to capture the regional and local distinctions that we knew would come out through the dialogue in those meetings. So we grouped some jurisdictions together just for logistics and convenience, but wanted to make sure that we didn't go too crazy in putting together too many disparate kinds of communities. So we held 2 town halls per day for each of the 24 jurisdictions, some of which were grouped together, which turned into a total of 18, as I mentioned. So 1 in the morning and 1 at night. These were independently facilitated through the help of some of the partners that I mentioned earlier, although we did have MSDE staff at each of those meetings, although certainly they were not there to actively participate unless there was a really clear point of clarification that needed to be made to help move the conversation along. All of the meetings were recorded for transcription purposes, but we assured the participants that their anonymity would be part of the integrity of the process, so no one would be quoted by name, et cetera, in any of our reporting. I think one of the really, not to sound overly positive about Maryland's process, but I think one of the really strong components of the work as we put together the town halls was our sort of framing of the event in each jurisdiction where it was held. So we started off each town hall with a joint presentation by folks from MSDE, usually Stephen himself, the Department of Human Services, and the Department of Health. And I think that really helped to set the context and the stage, if you will, for the participants in those meetings to really understand that the PDG birth through 5 work underway in the state really is seeking to forge that systemic integration and programmatic coordination. So it was a great way of starting off each meeting. In addition, we used KRA data to help frame the conversation so that jurisdictions could find themselves in the story of that data through data displays and then look at where their jurisdiction stacked up in the state as well as comparatively to statewide data. So those were two methods that I think help really make the experience more meaningful for participants as they headed into the conversation. We had really strong representation across the full early care and learning community, I would say. We had providers, both center-based and home-based, practitioners, staff, teachers, administrators, and teachers across local districts, local leaders, parents, community partners, folks that were represented on our own local ECACs. So a really great cross-section of the early care and learning community, I would say, across the region. And we did do a pretty intensive registration and tracking process so that we were able to really capture the participants, even though, of course, we won't be using their full identities as we report the data, but it was important for us to be able to track who was attending so that they might even be part of a follow-up process in terms of our strategic plan methodology. So, and I think all of the areas of the domains, the 11 domains that have been highlighted by federal guidance for the needs assessment and thinking about what the strategic plan will ultimately focus on, I think all of those areas were represented in the conversations that occurred, and they were really, we had a strong, protocol in place with set questions, but I think the other beauty of the town hall process was to see the organic conversations really evolve. So access, affordability, quality, how the system functions overall in terms of coordination and whether programs felt easy to access or duplicative or were lacking in terms of the way services felt provided to particular members of the community, as well as all of the other areas that have been touched on, professional development, the Maryland Excels, which is our quality rating and improvement system, and certainly, really understanding where needs felt unmet in the state, but also hearing from our stakeholders what some proposed solutions might look like. So very valuable, rich conversations for the town hall process. So moving to the focus group process, which is just wrapping up as well. In addition to the town halls, we held 22 more focus groups. And in this process, we also engaged our state ECAC early on in the process to help us think about the questions that we wanted to pose to participants in the focus group. So they were able to provide some input into the development of those questions just during one of their regular meetings, so it wasn't additional time being asked of those stakeholders. So again, these were independently facilitated, and in this context, we did not have MSDE staff actually attend because we wanted to really make sure that participants felt comfortable in expressing their views or raising their concerns. So MSDE vetted all of the questions that, of course, the ECAC helped to provide some input as they were developed, and the integrity, of a focus group research model, I think, was really upheld through our protocol. We did provide our parent participants, and I'll go through the various participants in each group. We did provide our parent participants with an incentive in the form of books that were selected at various age and reading levels, and also across a bilingual, just English and Spanish, unfortunately, scale. So our focus groups were grouped around community partners, providers, both family, childcare providers, and center-based providers. We did have separate breakout groups for Spanish-speaking providers, as well as Spanish-speaking parents, and then one for English-speaking parents. So those focus groups are just wrapping up as well. And then finally, our online survey. I was going to pipe up during the earlier conversation, but I thought that would just be a little overuse of Marilyn's time, so I'll speak to some of the points that were raised and commented on by some of the other grantees as well. Our survey is online. It isn't specifically focused on professional development per se, although we do have a version of the survey that was targeted towards our provider and administrator community. It was distributed through the town hall process itself, which was another great use of our time. We provided the survey while participants were there at the town hall with the survey link, so we used that as a distribution mechanism, but also used many of the listservs that MSDE maintains for various aspects of the provider community to make sure that the survey was distributed as widely as possible. It was translated into Spanish and English. And I'm trying to speak really fast so we have time for any questions. We had a great return on the survey, so we're currently in the process of analyzing those data. And again, it covered a wide range of different issues, and there was an open text box where people could also just respond to any issue or concern that they wanted to be heard on. So that analysis will be another important component of the needs assessment reporting. So our next steps are, of course, to synthesize all of this data and information that we've collected and fold all of these various prongs of the process into a wonderful report of our comprehensive statewide needs assessment process and findings and recommendations that, of course, we'll be submitting back to folks at ACF. I should also just mention really briefly that we have a few other components of the PDG work that would speak to the needs assessment data gathering process, and those would include, we've provided an opportunity for our local ECACs, so every jurisdiction in Maryland has its own local version of the the ECAC infrastructure, and they are able to apply for grants through PDG, and in so doing provide a local needs assessment back to us as part of that application process. So we're looking forward to folding that in. We also have a higher education inventory in partnership with the Center for the Study of Child Care Employment going on in the state as part of the PDG work. So we hope that we can continue to fold that information into our needs assessment process. And then through our WIDA Early Years project, which is an approach that supports dual language learners in the state, we have a parent research pilot underway, which will also gather information about where parents feel how well their needs are being met, particularly in the area of dual language learning. So again, it's an iterative process, as every part of this grant is and should be, and so we're looking forward to thinking about other ways to continue to inform our understanding of the needs and gaps and proposed solutions in the state. I'll stop there. Sorry if I took too long.
So we do have one question. We're running out of time, but we do have one question which I think other people would be interested in, which is about how many people attended your town halls and how did you advertise them?
Great questions. We had just short of 700 people total around the state, 686 to be exact. So it was a nice sample size. We advertised the town hall through just a variety of listservs and public communications mechanisms. So we had the link on our website as communications were sent out regarding other aspects of the grant. A reminder to take part in the town halls was included. And then our listservs, again, were targeted with just direct communications about the town halls.
Thanks, that's very helpful. And then I just wanted to point out one of the things Brittany pointed out in the chat box is in terms of the workforce development survey they did in New Hampshire. They were lucky enough that a county in their state recently conducted a workforce survey, and they were able to use some of the questions from that. I think I came across this in another topic I was researching where there was some interesting work going on at the county level, and you know, if you haven't reached out to some of your counties or some of your local communities to see if they may have something relevant to your needs assessment, it may be worth doing, because you may find something. I know sometimes, depending on how the state's structured, you may or may not hear about these things, and sometimes they can be very useful. And then just a general point about this sharing. If you have a survey, or a focus group protocol, especially if you feel like it worked really well, or on the other hand, if there's something that happens in your needs assessment process that you felt like, oh, I wish we had known this ahead of time because we would have avoided that pitfall, please do share that with your TA specialist, and especially if you're willing to share it with other states. I think it's really helpful to have an opportunity for everybody to kind of benefit from everybody else's experience. And, you know, people are at different places in this process. And I think to the extent that we can share materials that can help one state based on your experience, it would be very much appreciated by the other states, by TA specialists. So anything you have that you feel like, you know, you're willing to share and able to share, or if you have things online, just let us know, and we'll make sure we can get it out to as many people as possible. I realize we're almost done. I'm not going to go into detail in the needs assessment submission instructions. I think it's been something that's, you know, going to be part of some other discussions, and it was in the materials that Richard sent out. I would say, you know, part of it is just kind of one of the things that would be very helpful in terms of reviewing these, given the numbers and the depth of them, is something that clearly indicates where different requirements and domains are covered in your needs assessment when you submit it. So the people who are reviewing it are able to find those things and able to assess them based on your understanding of where they are, rather than kind of looking on themselves and trying to figure that out. If you say, this is where we answered that question, it'll be helpful, I think, both for you and for them. And then I think we're in the point where we have to kind of do the upcoming activities and closing. And I don't remember whether Sammy or Jim you're going to do this.
That's going to be me. So thanks, Chris. Thank you, everybody. First of all, before I get to the bullets, there were a couple questions that we didn't get to today. We are crafting a question and answer report that contains all of the questions that we received and either answered between the first call and this call, or some questions that we didn't get to that we will answer. And then we'll make that report available to all of you, so you'll have a Q&A concerning the needs assessment. To up-and-coming activities, just to bring to your attention, there will be a communities of conversation on the strategic plan guidance and the document that was released. The conversation will happen next Monday, June 17th, 3 o'clock Eastern, and then back yourself up, depending on where you are on the time zone process. There will also be the National Consumer Education Resource Webinar around supporting consumer education resources. That'll be on June 13th. You should have gotten a notice and an invitation for that. And then there'll be a follow-up. They call it Ask Me Anything on June 27th, so 2 weeks following on the same topic. We continue to have our communication with your federal project officers, and you should too. And please continue to reach out to your TA specialist. For those of you that are online within your states, if you want to share a draft of your needs assessment, please do so with your specialist. We'll be happy to get some information back to you before you official submission. We have created a peer-to-peer learning opportunity, so some states have asked us some specific questions, and we will be linking them up with a peer or peers that we understand have some answers and can give them some guidance. So we're doing that. You will be getting a follow-up email about this conversation, the recording, and there is a survey on that follow-up email. We are very interested in getting some feedback to you about how you think these conversations are going, is what we're calling them. Thank you all so much. We appreciate your calling in. We had quite a number of people call in again today. Thank you to Rachel and John for your willingness, and Leslie for your willingness to come on, and Sarah. And we will sign off. And again, if you have any follow-up questions, please get in touch with one of your PDG B-5 TA team members. And have a great rest of the week. We appreciate you signing off, or signing on, but I'm signing off, and so is Chris. Thanks, Chris. I should say also thank you, Sammy and Tanisha, behind the scenes for managing all of this work for us.